Psychological first aid, all right? It's different from diffusing and debriefing, and as much as it can be used in the field and in diverse settings, actually where the stress is actually happening, the stressor is actually happening. It can be used with children, adolescents, and adults, and has a level of empiricism attached to it, so we know it'll work. And I think one of the main goals of the intervention actually is to decrease the initial distress, all right, that's associated with the exposure to trauma. So this is great for parents and even for adults who are finding themselves, people who are exposed to trauma, and you want to get right in there as fast as you can to sort of kind of, bring it down a little bit. And so, like, we don't use debriefing with them. Instead, we allow them to tell as much as they want to about the traumatic event that has just occurred, or as little as they want in whatever style they want. We never push. We don't push for information, and we don't process with them. This is very important. So psychological first aid, I think, has a lot of great implications for helping us get through the traumatic event for everybody involved. And for acute, and it has serious implications for chronic trauma too that might be ongoing, because for some people, acute trauma, we find that, they can be covered in 5 to 12 sessions, all right? Or sometimes, an extended walk with your friend, a couple times around the hill, around the block. You might have to do it for 30 days, but you'll see a difference, right? Because it actually exposes neurotransmitters, and when people start to talk and they start to get that pain relief, it releases endorphins from the neurotransmitters, and they start to physically feel better. So this is why, we minimize talk, we minimize prayer, we minimize meditation. I'm going to tell you right now, it is an intervention. All right, so the interventions. So psychological first aid, diffusing, and then something I think that brings a lot of people solace: prayer, meditation, and human contact.
All right, we are back with Dr. Gabe. You can continue.
So I wanted to, I think we were talking about the interventions, what we might do to help victims and victims in close proximity to the victims, in cases where kids have been the victim, then parents and siblings, etc., becomes an issue. One such intervention is what we refer to as PI. That's an acronym. It stands for proximity, immediacy, and expectancy.
Thank you so much, Dr. Gabe, for giving us so much insight. You help us understand our symptoms even more, probably symptoms of people around us. Now we're like, wow, that's why so-and-so act that way. But but I think it's so important to have, it's like revelation, having that knowledge of what's going on, so this way we can get the help that we need. And a lot of us don't do that. And I know it's over time that we, like you said, learn how to heal. We grow and we heal and let people, what you said was important about letting people process on their own. Right. And I talk about that a lot. I mentioned that even in my video. It's not great when somebody's getting in a whole, when you need to de-escalate someone, you can't do it while their nervous system or while their stress level is so high. They have to calm down the whole nervous system before they can even hear what you're saying. And people do that in relationships. They get into these arguments and all you're doing is bouncing off each other, but nobody's getting anything from each other. You can't hear. I talk about the short-term memory that sometimes come over you when you in that state. So I just think it's so important. But I thank you so much. Your video froze again, and we're just going to leave it at that. But we so appreciate Dr. Gabe for joining us and giving us all this insight and some great, great, great information. I'm sure a lot of you benefited very heavily from it. And so I'm just grateful that we had the time that we have with him. And I apologize for all of the technical issues, but we got through it, and I'm sure you got some meat. Thank you again for joining From Trauma to Triumph Summit. You be blessed. All right, so anyway, we're wrapping up. Dr. Gabe, thank you so much.
It's my pleasure.
For your time. I'm so honored and everything. And, let us know how we can follow you and keep up with you.
Yeah, go to AskDrGabe.com. That's my website. Facebook at AskDrGabe, Twitter at AskDrGabe, Instagram at AskDrGabe. You can always email me. I'm at USC. You can email me there. But if you go to the website, it'll take.
We froze again.